Have you been researching Medicare Part D plans and feeling thoroughly confused about things like the deductible and the coverage gap? If so, you are in luck because in this video, I'll go over how Medicare Part D works and what the 4 stages of coverage are in every Part D plan. Hi there, if we haven't met yet, I'm Danielle Roberts, Forbes Finance Council member and co-founder here at Boomer Benefits, where we provide free Part D analysis each year for all of our Medigap and Medicare Advantage policyholders. Although Part D drug plans are offered by private insurance carriers, each plan must meet federal guidelines. All drug plans have 4 stages, and Medicare sets the limits for each of these stages during the year. Companies can offer benefits that are richer than the minimum standard, but not less than that standard. The 4 stages of Part D are the deductible, the initial coverage level, the coverage gap or donut hole, and catastrophic coverage. Let's start with the deductible. The deductible is the amount that you pay out of pocket first each year on your medications before your copays kick in under your plan. Medicare sets the maximum deductible each year, and Part D insurance companies must keep their plan deductible at or below that number. In 2019, the maximum deductible will be $415. Again, companies can waive that deductible or set a lower deductible, but they can't charge a higher deductible. Here's how the deductible works. If your plan has a $415 deductible, you will pay out of your own pocket for your medications until you have spent that much and satisfied the deductible. For example, if you have a medication that costs $100, when you go to the pharmacy, you'll pay $100, and then you will only have $315 left to spend before you have fulfilled the deductible and moved on to the initial coverage level. I mentioned earlier that some insurance companies may offer a lower deductible than Medicare's standard deductible, or they may waive the deductible entirely. A plan with no deductible, though, isn't necessarily the one that's most cost effective. Sometimes you may find a plan that waives the deductible, but you may also find that that plan has higher copays or premiums than another plan with a deductible. In my experience, you'll spend that money one way or the other, either in an upfront deductible or tacked onto the copays that you spend throughout the year. The second stage of a Part D drug plan is the initial coverage stage. During this stage, you will pay a copay or coinsurance for each medication based on what tier the drug falls into. Insurance companies have a list of covered medications on each plan, and these drugs are usually broken down into 5 tiers: preferred generic, non-preferred generic, preferred brand, non-preferred brand, and specialty medications. Each tier will have a copay or coinsurance associated with it. Typically, the preferred generics will have the lowest copays and the specialty drugs will have the highest. For example, you might find a drug plan that has a $5 copay for preferred generics, $10 for non-preferred generics, and $40 for preferred brand name drugs, and so on. The copay or coinsurance amount listed for that tier is what you'll pay for your medications in that tier when you pick them up at the pharmacy. Now, as you are filling these medications, Medicare is tallying your total drug spending, including both what you pay and what the insurance company discounts or contributes toward these medications. If the total drug spending goes over a certain limit each year, you fall into stage 3, which is called the coverage gap. Sometimes people refer to this as the donut hole, and it is part of all Part D drug plans. When you are in the coverage gap, your plan can charge you as much as 25% of the cost of your brand name drugs and a slightly higher percentage of your generic drugs. Now, why would our government place a big coverage gap right in the middle of these plans? The coverage gap was built into Part D to encourage people to use generic drugs whenever possible. This keeps the cost down for the National Part D program as a whole. When you use generic medication, you have a better chance of staying under that coverage gap threshold and avoiding the donut hole altogether. Let's look at an example of how your costs might change once you reach the gap. Say you have a Part D plan where one of your Tier 3 brand name medications costs $400 retail, and your copay for Tier 3 meds on that plan is $50. During your initial coverage level, you'll pay $50. However, when you reach the coverage gap, many plans will switch to charging you the full 25% of the cost of that medications. This means when you hit the gap, you would go from spending $50 to $100 on that same medication. Weirdly enough, because of the way the percentages work, you will sometimes see little to no increases when you get into the gap. But if you have some expensive brand name medications, you just need to be aware that you may pay as much as 25% when you reach that donut hole. So all in all, the coverage gap may mean that you pay more than before on some of your medications. You'll want to work with your doctors to keep the cost of your medications as low as possible so that you can hopefully avoid the gap altogether. Finally, stage 4 is called catastrophic coverage, and this is the stage that kicks in to protect you from catastrophic drug spending on your medications. Once you reach stage 4, your Part D carrier must pay 95% of all the cost of your covered medications for the remainder of the year. In my opinion, having catastrophic coverage is the single best reason to sign up for Part D. It greatly limits the spending that you would otherwise pay for catastrophically expensive medications, and in 2019 that limit is $5,100. Once that stage is reached, you'll pay only 5% of the cost of your covered meds for the rest of the year. If this all sounds confusing and you wonder how in the world to choose a plan, I have some tips for you. First, Medicare's website has a plan finder tool, and you can enter your medications and it will tell you which drug plans will cover the medications that you need at the most cost-effective price. If you're doing this enrollment on your own without the help of an agent, I highly recommend it. It's an excellent tool to help you compare costs. Second, if you happen to have your Medigap policy through Boomer Benefits, you can request our free help with Part D. We'll run the plan finder analysis for you and help you select a plan that makes the most sense so that you can choose wisely. If you enroll through us, you can also call us for free support on the back end if a pharmacy won't fill one of your medications due to a prior authorization requirement or a quantity limit. These kind of things happen with Part D all the time, and my team provides free assistance to our policyholders in resolving them so you're never alone with Medicare. All right, so that's it for How Does Medicare Part D Work? Please visit the Boomer Benefits website for more information on how Part D works, what it costs, and why you need it. And if you found this video helpful, please hit the subscribe button so that you will always be notified when we release a new video about Medicare. Thanks for watching, and we'll see you in the next video.